Before taking Zeposia, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once a day or every other day. Swallow the capsule whole. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Take this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or take this medication more often than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Do not stop taking this medication without consulting your doctor, as your condition may become worse if the drug is suddenly stopped. Report any new or worsening symptoms to your doctor or pharmacist right away. The manufacturer recommends avoiding certain foods and beverages that are high in tyramine, as they may increase your blood pressure while taking Zeposia. These include aged cheeses, dried/aged meats, preserved fish, products with large amounts of yeast, fermented foods, most soybean products, broad/fava beans, and certain alcoholic beverages. Ask your doctor or dietitian for more details and for a list of foods to limit or avoid. Tell your doctor if your condition gets worse. Some common side effects of Zeposia 0.92 mg capsule may include back pain, dizziness, and lightheadedness. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. When you first start taking Zeposia, you may experience temporary slowing of your heartbeat. Your doctor may slowly increase your dose during the first 8 days of treatment to decrease this risk. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects, and most people using this medication do not experience serious side effects. Zeposia may also raise your blood pressure, so it's important to check it regularly and inform your doctor if the results are high. Additionally, this medication may rarely cause serious liver disease, so seek medical help immediately if you experience symptoms such as nausea, vomiting, loss of appetite, stomach pain, yellowing of the eyes or skin, or dark urine. Zeposia can weaken your immune system and increase the risk of infection while you are taking it and for 3 months after your last dose. It's important to notify your doctor if you develop any signs of an infection, such as a sore throat, cough, difficulty breathing, fever, chills, or cold/flu symptoms. Do not start Zeposia if you already have an infection. Furthermore, Zeposia may increase your risk of getting a rare but very serious brain infection called progressive multifocal leukoencephalopathy, PML. It's important to seek medical help right away if you experience any new or worsening symptoms that have lasted for several days, such as clumsiness, problems with strength, balance, speech, eyesight, or thinking. Finally, it's important to seek immediate medical help if you experience any very serious side effects, including shortness of breath, severe dizziness or fainting, unusual tiredness or weakness, eye pain or sensitivity to light, vision changes, mental changes, seizures, severe headache, or signs of a serious allergic reaction such as rash, itching, swelling, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, make sure to contact your doctor or pharmacist. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using this medication, it's important to discuss your medical history with your doctor or pharmacist, especially if you have breathing problems, current or recent infections, diabetes, certain eye problems, heart problems, high blood pressure, liver problems, or if you smoke. This drug may make you dizzy, so it's important to avoid alcohol or marijuana, and not to drive or operate machinery until you can do so safely. It's also important to stay away from anyone who has an infection that may easily spread, and to talk to your doctor if you have been exposed to an infection or for more details. Before starting treatment with this medication, it's important to discuss your vaccine history with your doctor and ask if you need to get any vaccines. If a live vaccine is needed, it should be given at least 1 month before starting this medication, and you should avoid contact with people who have recently received live vaccines. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or plan to become pregnant, you should not become pregnant while using this medication, as it may harm an unborn baby. It's important to ask about reliable forms of birth control while using this medication and for 3 months after the last dose. If you become pregnant, it's important to talk to your doctor right away about the risks and benefits of this medication. It is unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. And as always, it's important to consult your pharmacist or physician for more information. It's important to be aware of potential drug interactions with Zeposia 0.92 mg capsule. Other medications that weaken the immune system or increase the risk of infection may interact with this drug. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Additionally, avoid taking MAO inhibitors during treatment with this medication, and consult your doctor about the best time to start or stop taking this medication. If someone has taken too much Zeposia and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with others. Before starting and during your treatment with Zeposia, you may need to undergo various medical tests such as complete blood count, blood pressure, pulse, EKG, MRI, eye exams, liver function tests, and lung/breathing tests. It's crucial to attend all your medical and lab appointments. Make sure to consult your doctor for more details on these tests and appointments. It's crucial to stick to your treatment schedule as prescribed by your doctor. Make sure to ask your doctor about what to do if you happen to miss a dose of Zeposia. If you do miss a dose within the first 14 days of treatment, you may need to start at a lower dose again and gradually increase it. If you miss a dose after the first 14 days, simply skip the missed dose and take your next dose at the regular time. It's important not to double the dose to make up for the missed one. It is important to store Zeposia 0.92 mg capsule multiple sclerosis agents, general at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless directed to do so. It is important to properly dispose of this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.